up our third party streaming. So bear with me. Okay. How do I flip the camera? Okay. All right. Everything should be set up now. Sorry, it's a one woman show over here setting up the third party streaming, but we will be joined by Dr. Yen tonight or this afternoon if you're over on the East Coast. Let me see. How do I do this? Housekeeping while we wait for Dr. Yen to join. If you have any questions, please ask them. We'll be answering any and all questions.
Hey, everybody.
Hello, Dr. Yen.
I am good. Today? Always good to see you. Like all the degrees in the back.
Oh, I'm in my father's office right now. They're not mine. But I do have a degree somewhere collecting dust. I got to get it framed still. I'm like 4 years post-grad and still haven't gotten it framed. But I know what Christmas
gift I'm getting you. Frame.
It's a custom sized one, so I have to get a custom frame. All right, that's enough on my degree though. So Dr. Yen, we're going to be talking tonight or this afternoon about all things birth control. So how it works, the birth control edition. I guess I always like to start off by asking you each type of pill, and then we can, or each type of birth control method, and then we can go into the nuances of each one and how they're all unique in their own way.
I want to give a shout out to, I see Belle Lepera join on, and anybody else that's watching, thank you so much for tuning in. There are so many methods of birth control, and I'm going to go over all the major ones out there from most effective to least effective. So in 10 seconds, all of the options you got out there. Most effective is the implant, which is crazy that it beats vasectomy. Something in your arm beats vasectomy. Then comes the hormonal IUD, which beats tubal ligation. And tubal ligation is in a person with tubes, ovaries, and a uterus. Snip, snip, take out an inch on each side, burn, and then you still get pregnant. That shows you how crazy fertile some people are. So, but the IUD with hormone beats that. Then comes the IUD copper, which is under that. And my two things there is just know that the major side effects of the copper IUD is more blood, more cramps. So if you're the kind of person who's like, oh, is that blood running down my leg? You're a great candidate for the copper IUD. If you're like me and you're like, I feel every single blood drop coming out. No, maybe not you for the copper IUD. Then comes the shot, which is every 12 weeks technically. And the negative on that is it gives you munchies and it's not great for skinny people's bone density, but anything is better than pregnant because a growing embryo is going to eat all the calcium off your bones. And if you don't want to be pregnant, anything is better than pregnant. So there's the shot. And then comes the vaginal ring. The vaginal ring comes in two flavors. There's a 1 year, I'm looking for the, oh no, did it escape? There's a 1 year ring. And what's cool about it is 1 year. And you just stick it up there yourself, whenever, however, leave it there for a year, or you can take it out every 3 weeks, have a bleed for a week and stick it back up. The negative is we don't recommend that until you're 30 years old because it only has 13 micrograms of estrogen. So not necessarily good for your bone health. Then there is the monthly ring, which has 20 micrograms of estrogen, which is better, but still not as good as the 30, but not as bad as 13. And then there is the patch. There are two different patches. The old patch doctors generally aren't friends of because it has high estrogen, and too much estrogen increases your risk of blood clots. But Torla was specifically formulated to only have 35 micrograms of estrogen. So 1, good enough for your bones. 2, not too crazy high so that you won't have a blood clot and die, because that would be horrible. Then comes the pill, and the pill is everybody's pretty familiar with it. And you can skip the last week of the pill, the patch, the ring to make hashtag periods optional. Then comes condoms, and then fertility awareness methods and spermicide.
That's a lot. So I see that Susan down there asked about over the counter birth control. So all of the non-hormonal methods are over the counter.
They're not the copper IUD.
But or the copper, not the so like condoms, spermicide, the sponge, all those barrier methods. But I know that there is a pill. I don't know if it's fully over the counter yet or if that's something that they're working on. But that leads into this next question I wanted to ask you about is the different types of pills and what that means as far as their hormones and what each hormone does.
It's important to know that when we say birth control pill, we're usually talking about an estrogen and progesterone pill. However, there are pills that are progesterone only pills. In general, as physicians, we've stayed away from the progesterone only pills. And the reason for that is it generally in the United States, when we say progesterone only pill, is norethindrone. And if you take it 3 hours late and you had sex in the past 5 days, you're going to need some emergency contraception. And even then, there's no guarantee that's going to work. It's just extra protection for you. And so our joke in medicine is, what do you call a woman on a progesterone only pill? You call her mama or pregnant, because it's just so hard to stay within that 3-hour window. But it is good for women who are breastfeeding. So if you're breastfeeding, we don't recommend the normal birth control pill because the estrogen will stop the milk, and we want you to be able to breastfeed if that's what you're trying to do. And it's also best for your new baby and best for you as well. So that's why we also call you mama if you're on the progesterone only pill. However, there is a new progesterone only pill called Slind, and that one has a greater window. The negative on that one, it's like $230. And so a normal progesterone only pill is like $20 or maybe sometimes even less, but Slind is $230. And it is a progesterone only pill. There's also it's called the O pill. And that one is norgestrel. And what's crazy is they're all like, it's been FDA approved forever. And yes, it's absolutely safe. But oddly enough, they didn't put it on the market in the United States. And now they're trying to get it over the counter, which is totally fine, totally safe. What's cool is this one may not have the 3-hour window, but even the study that they're citing is like, we don't have enough research. If I were you, I'd stick to the 3-hour window. And I'm like, yeah, better safe than sorry. So hashtag get the good stuff. If you have access to an expert birth control doctor, which you have with Pandia Health, we can write the prescription in all 15 states, and it's a total steal at $30 once a year to use our expert doctors. Think of your time, your stress of scheduling a doctor's appointment, going to a doctor's office, waiting for the doctor, seeing the doctor just to get your birth control. And even then, they're not the best and the brightest on birth control. We've only focused on birth control for the past 7 years. And I went to UCSF. I teach at Stanford. And I went to MIT, and I used my brain and optimized birth control and taught all of our doctors what we call the Pandia way. That if we give you this birth control pill, we're pretty sure 95% of the time you're going to do amazing. And if you don't, then in 10 weeks, we're like, hey, you have any breakthrough bleeding? You have any zits? You have any munchies? Well, we got a algorithm graph that we can turn this up, turn this down. And if you're having problems with your current pill, come to us. We'll help you find a good one. Know that there's 40 different combinations, levels of estrogen, progesterone pills that you can try. So if you don't like one, there's 39 others that you can try. And most importantly, know that there's 8 different progesterones. And so if you don't like one of them, know that there's 7 others. And if you can't access our amazing doctors, then at least talk to your doctor and be like, Dr. Yen of Stanford said that there's 8 progesterones and this one doesn't work for me, so let's try the other 7.
Absolutely. And so just to be clear on the over-the-counter one, that's going to be a progesterone only one. And those are a little tough to take. It's a double-edged sword because we're sitting here, we want birth control to be as accessible as possible, but it is the fact of the matter that birth control is not one size fits all. So it's hard to sit there and make one type of birth control over the counter when realistically you do need a doctor that's an expert, because I know that with my birth control journey, I was on any pill. I didn't even know that there was different pills when I first started. It was like, I'm on the pill. So and once I was able to finally get a personalized prescription, it totally changed my experience with birth control. So if you're struggling with annoying side effects that we can dive into, definitely go see a doctor, like our expert doctors. So what are some side effects that they should be looking out for that are not necessarily normal parts of
So
the
if you're bleeding on the birth control pill on the days that are not the placebo week, so a lot of the packs will have 3 weeks of one color and 1 week of the sugar placebo bleeding week. If you're bleeding on these days, something's not right. If it's your first time starting, yes, you can have some breakthrough bleeding. And we actually recommend, if it's your first time starting, start on the last day of your period. Because if you start on the first day of your period's trying to bleed and you're trying to throw hormones, you're trying to stop it. And so there might be like more breakthrough bleeding. But if it's all cleaned out, like a fresh new palette, and then you add the hormones, then the odds, I think, of breakthrough bleeding are less. And so if you're bleeding in these 3 weeks, something's messed up. If you're trying to go to periods optional, usually people can get through like 3 packs of these before they have some breakthrough bleeding if you're trying to go for 0 periods. But that should be fine if, just you shouldn't be bleeding in the first 3 weeks of taking a pill. Otherwise, you're not taking them right, or it's a not good enough progesterone for you. Asians and Blacks seem to need a touch more, don't bleed as much hormone in them. And it may be because we eat through the hormones faster in our liver. We digest, clean out drugs faster than other people. And that's something that we've noticed at Pandia Health, is that a lot of people could benefit from a little more progesterone than what most people are teaching, most doctors are doing at academic institutions.
So what are the aspects what are the different aspects of each person that makes that you guys take into account when?
So the difference between just getting something over the counter and seeing a doctor, seeing a Pandia doctor, is we train all of our physicians to note the patient's body mass index when it comes to emergency contraception. We have it such that if your BMI is 26 or greater, we tell you, Plan B and its generics isn't going to work so well for you. Maybe you want to consider Ella. And it's not because I get any money from Ella, but it's because I don't want anybody getting pregnant that shouldn't get pregnant. And so if your BMI is 26 or greater, the research has just shown different body sizes, the volume of distribution, the way your body metabolizes that drug is different. And there has been a physician who gave us hope, and she's like, oh, if you double it, then it doubled the increase in the blood. But when she actually studied it in a research study, noticed that wasn't good enough. So you can't double up, that won't help. We used to think it did. We no longer think it does. And then if your BMI is 30 or greater, Plan B and its generics do not work at all. So I think it's wonderful that there are these vending machines on campuses. They're going to have Plan B and its generics, but they really should have a sticker that says, check your BMI. If it's 26 or greater, not going to work so well. If it's 30 or greater, not going to work at all. Consider Ella. And that's why at Pandia Health, we're like, you want some Ella with that? And again, if it were me, my friend, my patient, I would do Ella because it beats Plan B at every time point in its effectiveness. And the difference may be 1%, but if you're that 1%, that's 100%, and if you want to do it by percentages, it's like a 2% chance of pregnancy on Plan B and its generics versus a 1%. But one could argue that's double. That's 100% difference. 2% versus 1. It's just how you personally look at numbers. But I'm like, I don't want any chance of getting pregnant. So that's number 1. 1 is BMI. 2 is age, because I'm an adolescent medicine specialist and I've been surrounded by people who are focused on bone density. We know stuff your doctor may not know. A lot of people are like, I want the lowest hormone possible. No, you do not want the lowest hormone possible if you are under the age of 30. Because from age 15 to 30, you're growing your strength of your bones, what we call feeding your calcium bank. And if you don't feed it enough, then it's going to fall and you're going to hit a crack a lot faster than if somebody else got up higher and got more calcium before they started depleting their calcium bank. And so
Wow.
again, our Pembia PSA for today and right now is no less than 30 micrograms of estrogen until you're 30 years old. And that is a concern with the progesterone only pills. We're not quite clear their effect, but we know for sure Depo-Provera blocks your bone acquisition during that time. The good news is if you come off Depo-Provera, I believe at 3 to 5 years, it goes back to what it should have been. So we were concerned about that. But we don't know what it is with progesterone only pills because just nobody's been using them because they haven't been that great.
Interesting. So for Depo, is that something that you wouldn't start a younger
Generally, I'm not a fan of Depo because of that. But it's a risk benefit ratio. Again, if you get pregnant, that pregnancy is going to suck up a lot of calcium. We definitely counsel people, if you go on Depo, make sure you're getting 1,200 milligrams of calcium each day and 400 international units of vitamin D. But I counsel that of anybody from age 15 to 30. And then if you have larger bones, then you're probably okay. But if you're like some scrawny, person, then that person's definitely at risk. If you're lactose intolerant, Asians, Blacks, Latinos, that's also, a consideration as well.
Interesting. I know I interrupted you. There's another aspect that you guys take into account.
So we definitely have to review everybody's health history and look at, are you a smoker? Look at, do you have lupus? Do you have any blood clotting disorder? Stuff like that. And then lastly, we're using race as a proxy for genetics. And so what it is as a woman of color, and I realized everything we were taught at these academic institutions is for a Caucasian female. And then I talked to my fellow Black doctors, fellow Asian doctors, and we're like, is this working for you? Because I keep trying this and it's not working for me and it's not working for my patients of color. And we're like, oh yeah, that only works for white people. So if you're a Caucasian female and wants to bleed every month, go with what, the institutions are teaching. But if you have any ethnicity in you, we've noticed after taking all the birth control pills, ranking them from most likely to make you bleed, least likely to make you bleed, most likely to give you munchies, least likely to give you munchies. We took that pill, put it here, and then we bumped it up a little so that there'd be less breakthrough bleeding. And with that, 82% of people that start a birth control pill with us continue versus the standard 55%. So we've greatly improved the experience for 25-30% of women out
there. Wow. That's amazing. Yeah. Those are some pretty good numbers. I want to talk about one of the most commonly cited side effects. And I think I probably struggled with this at one point when I was younger, but acne. Is acne, I've heard a million different things about it. So acne can be helped or hurt by birth control. So what the
research shows is that if you have hormonal acne that's made worse by the up and down of your hormones every single month, by stabilizing the hormones, no matter what pill you go on, your acne gets better. There were actually 2 drugs that bothered to go through the FDA testing because it costs $5 or $10 million to go through that kind of process. And so the other one's like, it's not worth it. But this 2 companies specifically went through to test. And so when you do the research, you'll see only 2 have been FDA approved or shown to help with acne, but other research has shown that any birth control pill, if you're affected by the up and down and it goes smooth, then your acne will be better. However, again, each person is different and there are 8 different progesterones. And we would characterize some of these progesterones as more zit giving, more munchie giving, more libido. So I've had the problem, some patients are like, I don't want zits, but my libido is down. It's like, it's one or the other, chica. If you want more libido, you might have more zits. And it just depends on each person. Like if I bump it up a little, that person might not get zits. But if I bump it up a little in someone else, oh yes, there will be zits, And so it's important to know that the research shows anything should work. However, if you go on this one and you get more zits, then try the other 7 that are out there, okay? And then know that there are doctors who know which ones are better for acne, which ones are better for polycystic ovarian syndrome, The one that's the best out there, the key is you have to be able to drink 8 glasses of water. So if we ask you, they're like, why are you asking me about water? What I'm talking about birth control? And it's like, because if you don't drink 8 glasses of water, you're going to end up with a headache, because it also has a diuretic effect. And so then if you're peeing and you're not drinking, then you get a headache.
Interesting. So I guess it always just comes back to finding the right doctor to get you the right birth control, which is, we do that. So I'm sorry, I'm totally like,
thank you for doing this at the end of the day. I really appreciate it.
Fine. I usually drink a few cups of coffee, and I'm only, but I just wanted to go back to the progesterone only pill. I had a question there with the SLIND window. What is the number for that
SLIND
window?
is much more forgiving. I believe you can be late by 24 hours versus the 3 hours. So the window is kind of like the birth control pill. We say if you miss one, take one as soon as you remember it. If you miss two, take 2 today, 2 tomorrow. One could argue similarly with SLIND. The negative on the progesterone only pill, one, it doesn't consistently block ovulation. And so what's beautiful about the pill, the patch, the ring with estrogen in it, one of those, but the patch and the ring all have estrogen, but the pill may not. I'm sorry. Yes. And so they decrease, by blocking ovulation, they decrease your risk of ovarian cancer. The progesterone only pills 30 to 60% of the time block ovulation. So it's not going to give you the same amount of protection against ovarian cancer. And then the one that is, I like making #periods optional. And with the progesterone only pills, we're not sure what the pattern is. Each person is totally different. Some people may have lots of breakthrough bleeding. Some people may not bleed at all. But again, I feel that's more the 30% non-ovulation group. But then the other 70% will continue to bleed every single month. And that's why I like the pill, because there's 40 different pills. And I'm pretty sure out of one of the 40, I can find one that stops you from bleeding every month if that's your desire.
Awesome. It's funny you brought up periods optional, because my next question was going to be, like how there are a million different methods, each method kind of has a nuance of how you skip your period. And I wanted to talk about skipping your period, and specifically how you do it for the pill, patch, and ring, because I know the patch is a bit different.
So let's go over the pill. So the pill is, as we know, this is a full pack, shows you 3 of one color, 1 of the other. If you have a brown last pill, that's usually a Fe, you'll see in the name of it. And Fe just means iron. And the reason they give you iron is because they made you bleed. So they're trying to give you back the iron that they're making you bleed. Know that this week is totally optional. You can bleed once a month. You could bleed every 3 months. You could bleed 6 months. You could bleed never. If you ask most physicians, they bleed never. Because why bleed? The only reason there's this bleeding week there is they're like, women can handle it if we didn't make them bleed every month. And I'm like, I believe in choice. Give me the choice. I will choose if I bleed every month, every 3 months, every 6 months, but I'm going with never. And we ask our patients when they come, do you want to bleed every month, every 3 months, 6 months, or never? Your choice, your body. So then there are packs with only the active pills. And then this last week, they tell you just go a week off. So if you want to make #periods optional, just skip this week off and go straight into the next pack. Always be taking an active pill every day. So on this pack, what you would do is take all these white ones, and as soon as you get to this last white one, go straight into the first day of the next one. And what it looks like on your pill pack is this. You'll always have that last week empty because you started the next one. Okay, so that's how you do it on the pill. On the patch, you wear a new patch 1 week at a time. We had one patient who wore it for 1 day, took it off, and then changed another one next week. I was like, oh no, you are not covered. So please, patch 1 week on, take off. New patch 1 week on. New patch 1 week on. And you can keep doing this for 12 times, but no more than 12 times in a row. Because unfortunately, the estrogen starts building up with the patch. Not with the other drugs, but somehow with the patch, it starts building up. And at 12 weeks, it builds up to a point that we don't want, increases your chance of blood clots, and maybe cancer and other stuff like that. So no more than 12 weeks in a row on the patch. So then come off for a week, have a bleed, clean out, let those hormones drop back to normal, and then you can do it again for 12 different patches, but no more than 12 patches. The vaginal ring, I'm still looking for my ring because it looks so cool, but somehow it has escaped in my bag of goodies. Oh, wow.
I wish I
Awesome.
found
So the
I have
ring
the
you put in your vagina however you want. Doesn't have to be a particular way or direction, as long as it touches the mucous membranes and it's giving out medicine. It gives out medicine for 35 days. No month has more than 35 days. So it's pretty cool. You can be like, today is May 8th, right? And then just do it on the 8th of every month. Or my birthday is the 10th of the month, and change it on the 10th of every month, because again, no month has more than 35 days. It actually has 35 days worth of hormone. So if you don't want to bleed, just change it every 35 days. If you notice, again, each person is different. Each person eats through their hormones faster or slower. If you notice that if you go beyond 28 days and you have a bleed, then change it every 28 days. Avoid that bleeding situation. And then with any of these, if you're trying to get to know periods, oftentimes the first time you try, you get to 3 months and then you have some breakthrough bleeding. Come off the active pills for 5 days. Just don't take pills for 5 days. And then during that time, the hormones will drop. You will clean out your uterus, reset the palate, as I like to say, and then restart again. And hopefully the next time you'll get out to 6 months, the next time you'll get out to 9 months, and then you may be home free like me. I have not bled for 13 years, as long as I remember to take my pill every single day. And sometimes I forget because I'm out of town or whatever, or I take some Sudafed and it eats through my hormones, whatever. It happens. But you can go to no periods. Two random facts. If you take Sudafed or ADHD med, that revs up your liver, and your liver starts eating through hormones faster, and then you'll get breakthrough bleeding. So that's one cause of breakthrough bleeding when you're trying to get to #periods optional. The other cause is if you don't take your pill every single day. But what else was I thinking of other causes? Oh, lastly, roommates and coworkers. So the example is I was at MIT and we had 3 roommates in the dorm, very close quarters. One was every 28 days. Then we had me every 35 days, and then we had the other person every 90 days. That's polycystic ovarian syndrome, affects 1 in 10 women. We'll talk about that later. But the 28-day woman had such strong hormones that she infected us. And we all pulled the 28 days. And so the 28-day lady is a cure for infertility, but she's also the cause of bleeding against your will. So if you have a friend that's every 28 days and you used to be able to go 3 months without bleeding, and now you're bleeding every 28 days, it's that friend. If you're spending 8 hours a night in a closed room with her pheromones circulating around, that can happen. We've also seen it in working quarters. I have a chiropractor, and she has a receptionist who has an IUD, wasn't bleeding on the IUD, awesome for her, but then started working for this chiropractor every 28 days. And then she got her period. And it's like, you gotta get her on something to turn her off, or you just gotta get a different job, or just deal with the bleeding.
That's crazy. That's what I'm gonna start asking all my friends, so I can plan out how much time I spend with them.
And yeah, I have 2 daughters, and my 13-year-old comes up to me and is like, "Mommy, I'm bleeding." And I'm like, "You stay away from me. I love you, but do not infect me with your blood. I will not spend enough time with you to get blood."
I know you brought up polycystic ovarian syndrome, and I'd like you to just give a little refresh or rundown on that, because I don't think everyone knows really what that is.
Yeah, so
what to look out for
PCOS,
there.
polycystic ovarian syndrome, the symptoms, the way you'd be like, maybe I have this, maybe I need to talk to a doctor, is hairiness, zits, and irregular periods. And not just like one irregular period, but like you don't get periods unless it's every 3 months, every 6 months. It's not safe without hormones not to have a period fewer than 3 to 4 times a year, because what happens in polycystic ovarian syndrome is there's a whole bunch of eggs trying to grow, and then one gets the most estrogen, and then it pops out and it wins. And that's a cyst that develops, and then it pops out an egg. That's ovulation, the egg coming out. And then when the egg doesn't make the sperm, then the hormones drop, and that's when you get a bleed. So, and there's progesterone made in the process. However, if you don't pop that egg, then no progesterone happens and no shedding of the lining happens. And so the lining of your uterus is growing, 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 growing. And we call that unopposed growth with estrogen and no progesterone. And once you throw progesterone and then you pull away those hormones, you clean the sucker out. And so without hormones, growing, 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 increased risk of endometrial cancer. That is one of the greatest risks of endometrial cancer. The other stuff that happens with endometrial cancer is your female hormone gets turned into male hormone, and then you get zits and you get hairiness, and sometimes you get baldness. So but that's also part of teen years. You get zits and you don't necessarily get hairiness and you don't get baldness, but you can't have irregular periods. But again, the irregular periods is what signals it. The zits, the hairiness, it affects 1 in 10 women. And you can imagine if you're not popping out eggs, then it's difficult to get pregnant. And so on the other side, when you're trying to get pregnant and you're having a hard time, 1 in 10 women have this. So please bring it up as a consideration for your doctor. Oddly enough, I gave a talk to infertility doctors, and I was like, well, how is my birth control talk going to help them? And they're like, oh, we totally use birth control pills for infertility. And what it is that PCOS people, hormones are way up here, whack and weird. We put them on the pill, they normalize. And as soon as they come off the pill, that is the most fertile they'll be, because that is the most normal your hormones are going to be. And so PCOS people sometimes hear, oh, I'm infertile, I'll come off the pill, it'll take a while to get pregnant. As soon as you come off the pill, that's when you want to get pregnant. Immediately go for it. That's also your highest risk of getting pregnant as well. So know that there's PCOS. We have a great talk on it. Google Pandia Health PCOS. I gave a talk for Stanford on dietary as well as medical treatment for that. And the pill patch ring is obviously one of those treatments for it, as is the IUD or implant. But it's better to have something that blocks ovulation consistently. So the pill, the patch, the ring, and probably the pill and the ring to go to #periods optional, because 7 days off the pill, they've actually shown is too long. 7 days too long. Probably 4 days maximum, because at day 5 and 6 you can have escape ovulation, and anytime you can have escape ovulation, you get a cyst. And with polycystic ovarian syndrome, these cysts build up in your ovaries and they get heavy and then you get twisted, and then you can lose your ovary, and that's definitely going to contribute to infertility.
So it's pretty much, it's better if you have PCOS to skip
your monthly bleed, because you don't want any risk of ovulation.
It's interesting too. I've seen some armchair doctors here and there on Twitter talking about birth control and it almost being the cause of PCOS. And birth control is a treatment for PCOS. So if you're coming off birth control and you find out you have PCOS, it's because you had it.
Yes, this whole exactly. Time. So that is one of the myths about birth control, is that it makes you infertile. And so what happens is you put 100 people on birth control, 100 people not on birth control, and then you check in 20 years who can get pregnant. And 10% of the people on birth control will have a hard time getting pregnant. You're like, ooh, the birth control did it to them. But 10% of the general population will have a hard time getting pregnant. And so there's no difference in the percentage between those on birth control, those on not birth control. It's just everybody got PCOS during 10% of those of us with uteri will get PCOS sometime in our life. And it is not the birth control causing the PCOS. The birth control was hiding the PCOS because it was treating the symptoms of cysts and excess male hormone and irregular periods. And in fact, a lot of people are put on birth control pills to regulate their periods. One, the number one cause of missing school and work is bad, evil, heavy, painful periods. But two, if you have PCOS, we put you on the birth control pill and it has a fake bleed 1 week out of each month. But you don't need, once you're on the hormone, it's very complex for me to explain to my PCOS patients. Like, you need to bleed 3 or 4 times a year, otherwise endometrial cancer. But if I put you on the pill patch ring or IUD or implant, you don't need to bleed. So that's the complicated part.
Absolutely. And that's why we go to the doctors, because they know all the complicated parts. Thank you so much, Dr. Yen. I feel like that was a ton of information packed into a half hour. But I mean, you are a walking dictionary of all things birth control. So it's always a pleasure to pick your brain. Are there any last final takeaways we want to give our viewers from today's TMI Tuesday?
The big Pandia pearls are: one, know that there are 40 different birth control pills. If you don't like one, there's 39 others, or at the very least, there's 8 progesterones. If you don't like one of the progesterones, there's 7 other progesterones. 2, know that there are different emergency contraception, and if you're going to do Plan B and its generics, please check your BMI. But if it were me, my friend, I'd take that out of the picture and just get Ella. Ella works to a BMI of 35. If your BMI is 35 or greater, then your only chance for emergency contraception is an IUD. But know that this is a good option. It's just invasive, and you got to find somebody to put one in within 5 days of your contraceptive failure. And then lastly, hashtag get the good stuff. There's all this talk about birth control going over the counter, and we as reproductive advocates absolutely want all birth control, hormonal pills, patch, ring to go over the counter. However, the one that's going over the counter is okay, but if you were to ask your doctor, is that the best one out there? Not necessarily. So if you have a doctor, or you have access to a doctor, and Pandia Health, we can prescribe in 15 states, and we really encourage birth control tourism. So like the example I give is we are not in New Jersey and Connecticut, but we're in New York. If you can get to New York once a year, California, Florida, Texas, Vegas, Georgia, Illinois, and other states that are slipping my mind right now, Pennsylvania, then just once a year, you'd be like, I'm in Pennsylvania, I'm in California, I'm in whatever. And then our doctor in California, Pennsylvania, Texas can be like, okay, I will write you a prescription. And then we can send it to all 50 states. So know that I think it's pretty accessible. We're bringing birth control to at least 15 states and their bordering states, and anyone who visits those states. And we're expanding as we get more money. So it's only $30 once a year. I think your health is worth it to get a doctor's opinion on what's the best birth control for you. And at Pandia Health, we are the only one who have this algorithm that takes into consideration your age, your BMI, in addition to your health conditions, and that are sensitive to women of color's needs.
Absolutely. Awesome. Well, thank you so much, and thank you everyone for tuning in. And have a great rest of your Tuesday with all that TMI.
So glad to see Tokyo tuning in and everyone else that tuned in.
Yes. Thank you guys. Everyone have a great rest of your day.